Governor Gavin Newsom last week announced that counties that are on the COVID-19 watch list would not be allowed to reopen their schools in the fall, concerning parents all across the state of California. And we're joined today by Rod Hsiao, who is a member of the San Mateo County Board of Education. Rod, thank you for joining us.
Glad to be here, Jason.
So we want to just get right into it. If you could give us an overview
Sure.
of what the status is of the different counties, the different districts within the county. We have 23 school districts in San Mateo County. How many of them right now are planning to reopen in person, and how many of them are going to stay with this distance learning model?
Jason, we've been trying to get a fix on that list of 23 school districts for the past month. The superintendents are compiling a consolidated list, but it's in flux. We know that roughly 6 to 8 are planning on starting off with distance learning first, at least for 6 weeks. And then there are a handful that are planning on coming in, bringing their students in and offering in-person instruction. And you can see there's a group in the middle that still haven't quite decided. So there's been a lot of changes back and forth as more medical information is being provided. Unfortunately, we're seeing the positive case rate rise instead of fall, which increases the risk of bringing cohorts into classrooms, both for students and the teachers.
Right. And what is the County Office of Education's role in helping districts make this decision? Or if they do decide to open in person, what's the county's role in helping to make sure that that's done safely?
Well, I'd say twofold off the top of my head. One is Superintendent McGee has been the primary conduit for taking information from Dr. Scott Morrow, and then interfacing with all the school superintendents to see how can we implement healthy and safe classrooms for the students. So she's the one who helped craft the 4 pillars, to make sure people are wearing face masks and exercising safe physical distancing, washing hands, not having large gatherings, and cleaning the classrooms. So she's really been kind of the nexus for that. There are a bunch of us at the trustees who've also been very involved, particularly on the School Board Association, because we have all the trustees from the local school districts coming together on a weekly basis to share information. So we've been trying to promote several things at that level. But to your main question of how we help support distance learning, there was another piece where the Office of Education actually launched a distance learning training program. We did this in conjunction with the Community College District and Notre Dame de Namur, and served about 300 teachers earlier this summer to help them to sharpen and hone their craft for teaching. So at least those teachers will be better prepared going into the fall reopening. And we believe they'll be reaching about 10,000 students. Because we know it's been a real struggle, really frustrating for families and students to learn through distance learning.
Certainly. So it seems like you're playing a large role in training the various school districts and being able to reopen and convening conversations. So through these conversations, what in your, we know a lot of needs and challenges have emerged as a result of the switch to distance learning, but what in your mind is the top most pressing concern that is being created as a result of switching to distance learning?
I really think it's school communication with parents and these providers. Help them understand what are the learning goals for that week. What are we going to be teaching them? What's the methodology or approach that we want the kids to get? Because you can't just, drop it in, deliver it to students and know that they're just going to get it. They often need some additional support and tutoring to help them with that.
Right. And we saw news earlier this week that the county Board of Supervisors approved a $2 million funding package to essentially help childcare providers remain open. And that we
That
had
was huge.
Councilmember Lee and Dana Chung on a few
Uh-huh.
days ago. So the county certainly has a role to play, but you mentioned the state is certainly involved as well. So which agency is owning the childcare piece, if any? Or is it a broader collaboration that's happening across multiple different agencies? And if so, who's really spearheading that?
Well, it's kind of it's fragmented. The whole when you go to out of school time care and education, it's a very fragmented market, if you will. So, First Five was also trying to fund and support a lot of early learning. The Child Care Coordinating Council, David Fleischman, has also been leaning in. But what I admire about Councilmember Lee and the others who spearheaded it is it really takes a village, and we need the village to step up. The $2 million, which was great, we thank the supervisors for funding that. That's honestly still a drop in the bucket. There are, I don't know the exact number, but I know that it's still only going to serve, less than 1,000, 0 to 5 students. And as I said, we have 96,000 school-aged kids in the county and about 26,000 that are low income. So that's why we're trying to leverage the relationships, our history of collaboration in the county to bring together for-profits, nonprofits, local governments to say, there's no silver bullet. No one's going to be able to drop $1 billion on this. But if each of us contribute a small piece of the puzzle, we can take a big chunk out of the need that we're seeing in the community and help support both the students and the families.
I want to dig into the question of equity for a minute because we've seen a lot of evidence that Black and Latino families in particular are facing the brunt of the coronavirus pandemic, both in terms of infections, but also economic impacts. But it also does seem like there is a disproportionate impact on those families as far as their children's ability to learn. So can you explain a little bit about what specifically those families are facing that other families are not, and how can we as a community support those families?
Well, Jason, that's a great question. I pay particular attention to the families that are low income, non-native English speakers, and they also tend to be the ones who are the ones who cannot stay at home watching their kids. We know that about a third of the workforce in the county are working parents. And we know that about 70% of moms work. So we really need to help them to find a place where the kids can be kept safe and engaged to allow them to focus on work. Because otherwise, unless we are able to give those students support, we'll see summer learning loss that's extended to just learning loss, period. Parents won't be able to focus on their school or career. And we'll just see a disproportionate impact on underserved communities. So I think number one is school districts really have to improve how they communicate to both parents and out of school time providers who are willing and able to watch after their kids. They need to be able to impart what are the learning goals for the week, what's going to be taught, what's the methodology or approach that we want the kids to master from the instruction that week. So in order to help promote that communication, we're trying to identify community-based organizations that are willing and able to take these kids, school-aged children, and then watch them and then offer homework assistance, technical assistance. So we're just trying to see how we can facilitate better communication because working through Zoom, you just can't be as effective in delivering education as you could in person.
So one of the justifications that I've heard from certain school districts for why they've chosen not to reopen is that the county of San Mateo has declined to provide support on contact tracing and testing specifically for school sites. How necessary is that support going to be in order to reopen our schools in the future?
Um, Jason, that's absolutely critical. We need to ensure that all the um, health and safety measures can be fully implemented. And then if there's a case, a positive case that emerges in a classroom, how can we quickly jump on it in order to prevent the spread and transmission? So uh, Superintendent McGee has been leaning in with Deputy County Counsel Claire Cunningham to work with our health department in order to provide for contact tracing. So um, there was a lot of confusion around that, but we will definitely be getting support from the health department in order to provide that level of public health support. And we're also we're actually looking at potential vendors to help us with testing. And each district will be ponying up some portion of the cost so that we have that at our disposal should a positive case or a potential case emerge that needs to be tested.
So I just want to be crystal clear then, because so you're saying that the county is planning to provide contact tracing and testing support to school districts.
Yes, it's still being hammered out, but they are not just walking away and saying, school districts, it's all in your hands. But we also feel like as educators, we need to continue to learn what is the level of risk, really. So next week, actually, I'm helping to co-moderate a panel where we're actually bringing our own local medical research experts from Stanford, from UCSF, so that we don't just get emails, we don't get a 2-minute soundbite during an open comment session, but we're going to listen to them for an hour and a half, ask them really hard questions about what's effective, what isn't effective, what's known about the COVID virus for school-age kids and the teachers and administrators. What is it that we don't know? So that we can be prudent and use that to inform our policy making.
Great. And I'll end with this. The U.S. Surgeon General earlier this week said that the matter of school reopenings is less a matter of preparedness of districts to do so, but rather the underlying community prevalence of COVID-19. Given that San Mateo County is experiencing by far the highest positive testing rates yet in the pandemic, and that we may be days away from being added to the state's watch list of counties, should any school district be planning to reopen in the fall?
We need to look at what is the positive case rate in the general population. School districts are only able to control certain things. What happens once the kids are on the school ground? And that's where the 4 pillars comes into play. All of that has, scientific basis for being effective. But to be sure, even if we did all of the 4 pillars and everybody adhered to it in a very rigorous and strict way, but the positive test cases were surging in the broader population, it introduces higher risk once you bring a group of students together in a classroom. And it poses real risk also to the teachers and the administrators. So there are, to be sure, structural issues in our demographics, in our communities, but there's some fundamental behaviors that if people could do a better job of avoiding gatherings without respecting physical distancing, without putting on face masking, that's what's escalating the case rate. And if people could just be a little bit more cautious and think about not just themselves, but about the other people that they may be infecting and transmitting the virus to later, then we'd be in a much better place with a lower risk students coming into the classroom. And I think at that point, we could manage the risk a lot better in the classrooms. So it depends answer. But I think that every school district has to consider what is what's the appetite of risk among its staff, among its families, and how conscientious our family is going to be about making sure that kids do respect the 4 pillars in the classroom, but also how they interact with groups of other people outside outside of school.
Right. Schools certainly don't exist in a vacuum. So everyone, please wear your
Right.
mask, wash your hands, and social distance. Right.
Please.
Well, Rod Hsiao, thank you so much. Yes, please, please, please. We all want to get back to normal as soon as possible. So, Rod Hsiao, thank you so
Yes.
much for joining us and for your continued leadership on this issue.